So if you're feeling any bit of overwhelm or information overload because you are searching the internet trying to figure out what does labor feel like, what can I expect, and you're feeling a little bit nervous about really understanding what you're really walking into, especially when it comes to labor and the whole pain aspect, you are not alone. In this video, we're going to dive deep into what does labor actually feel like, what can you expect from contractions, and what tips can you utilize in labor to be as comfortable as possible. Hey mama, welcome back to my channel. My name is Chanel, and on this channel, I help women go from a place of feeling very overwhelmed, anxious, and unprepared to feeling confident, empowered, and excited to walk into birth fearless and ready to have a beautiful, positive, and natural birth experience. So if that sounds like something that you're interested in, make sure to hit the subscribe button below so you can stay up to date on all the info and tips that you need to navigate pregnancy, birth, and motherhood. Now, one of the most common but challenging questions to answer about labor is, what does it feel like? So many women are afraid of the pain of labor because of the things that they have heard, the things that they've seen on TV, on social media, hearing really scary and negative stories from our friends and our family, which is so common, especially when it comes to pregnancy. And so I want to break down what you can expect from contractions, how to actually know that labor has begun, what to do about it, and how to stay comfortable in labor so that if you are desiring a natural birth, you have all of the tools to do that as long as possible and possibly even avoid medication altogether. Now, first, it's important to understand what to expect when labor begins. Our bodies will go through a variety of different symptoms and tell us that our bodies are preparing for labor. If you haven't checked out my video on ways to know if this is pre-labor or actual labor, definitely check that out so that you know what signs will give you some sort of clue that labor could be on the horizon. Now, the most obvious sign that labor is beginning is that you have contractions. But how do you actually know that they're contractions and that they're not Braxton Hicks or something else? Most of the time when labor begins, we are not 100% sure that it's labor. So one of the things that I see a lot of, especially in my first time moms, is that it almost is this experience or this feeling where it's cramping or aching, but you're not 100% sure if it's actually labor. And most women who are going through labor for the first time are really unsure in the beginning because it's so mild that you can really talk through it, continue your day through it, sleep through it, and really ignore it. Now, of course, there are outliers to this, and some women know right away that this is labor because it starts fast and furious. But for the majority of us, you can expect to be confused at the beginning of labor because you're just really not sure if this is the real deal. And some of the sensations that you may feel at the beginning of labor often are compared to period cramps. So if you've had any sort of menstrual cramps, not the crazy painful ones if you guys have crazy periods, but light menstrual cramps, it almost feels like I'm achy, I'm crampy, my back hurts. Those are signs that labor is probably starting if that is consistent. Now, the key here to knowing that you're actually in labor and that those are possibly contractions is that the aching and the cramp-like feelings are consistent regardless of whether you get up, you sit down, you move around. If you get up and you move around and they stop, then we're probably not in labor yet. But if your contractions continue to be somewhat consistent, and that can mean 10 minutes apart, 15 minutes apart, 20 minutes apart, but you feel that achiness, then there's a good chance that that's actually your contractions. With Braxton Hicks, a lot of times we will feel tightening just in our bellies. But with a contraction, as they begin to get stronger, if it's not just tightening in your belly, it's almost like a wrap around from the back to the belly, and then it ends again in the back. What I like to compare it to is thinking about somebody giving you a hug from behind. If somebody's giving you a hug from behind, you're feeling it all the way around. It's wrapping around your entire body. So as those contractions begin to get stronger and a little bit more obvious, and you're really noticing them, you will feel like somebody's kind of wrapping their arms around you, squeezing you and hugging you really, really tight, and then letting go. And it's a really good visual to actually keep in mind that somebody's kind of hugging you from behind, because when you have your contractions, you can think about your baby just giving you a big old hug and releasing as they're giving you a break to go in between those contractions. So when you think about labor at the beginning, it really is this cramp-like feeling where you're really kind of just confused. As that begins to get stronger, you will start to feel more of that wraparound, that hug, and that will become more consistent, and that will become a tighter hug over time. Now, it's important to note here that these do not have to be painful. For one, labor can be pain-free. That being said, just because you may experience intensity or you may experience pain during your labor, that does not mean that something is wrong. It does not mean that you're not doing the right things. There is a big discrepancy and a lot of controversy around the term pain-free birth. But the reality is, it is real and it can happen, and many of my clients have experienced pain-free births. I have experienced pain-free births, and I've also experienced births that are painful. In both of those cases, your body is doing what it's supposed to do. And sometimes our babies are just squeezing us a little bit tighter than others. And sometimes we just need extra tools to help us stay comfortable. That doesn't always mean medication, but it is important to note here that you don't have to expect pain to know that something is happening. And also, you can have the tools to maintain a comfortable birth so that you don't have to experience or expect this miserable, grueling journey that so many women talk about and experience, because maybe they have different tools or didn't utilize the tools that you'll learn in this video. Now let's talk about a few labor tips that will help you manage the pain or the intensity of contractions. The first tip that I want to share about managing labor contractions is your mindset. The biggest thing to keep you comfortable in labor is to keep your mind in your birth zone. That is actually going to require a lot of the work that you're doing in pregnancy. And if you are watching this video and you are later in your pregnancy, it is not too late to do it. I have helped women overcome their fears with weeks leading up to their birth so that they can become confident and know exactly what's going on so nothing scares them. It is important to know that your body is capable of this, that you are designed to do this, and that you and your baby are going to work together to come to the finish line together. So it's important to keep your mind in the right space. A few of my favorite tools to keep your mind in the right space is hypnobirthing. If you have not heard of it, I will drop some links below. Christian hypnobirthing is so key to help you stay in the right space. It will read scriptures to you, it will keep you in the right headspace, it will read affirmations to you, and really allow you to stay calm and collected. Another one of my favorite pieces and tools leading up to labor to keep your mind in the right place is supernatural childbirth. I talk about this all of the time. Birth is 80% mental, 20% physical, and I don't care who wants to argue with me, it is 80% mental. It will feel 80% physical if your mental is not in the right place. So you have to do the work to overcome your fears, to know what's going on, that your partner knows what's going on, so that you can actually become mentally confident in their ability to support you in labor. And that requires you both to become educated and do the mental work ahead of time, even if that means you only have weeks leading up to that birth. God did not give us a spirit of fear, and God did design this to be something that was enjoyable and beautiful. And if we can embrace that and prepare for that, there's absolutely no reason that we can't stay in our zone. The other piece of being in your birth zone and keeping your mind in the right place is your environment and your atmosphere. Just really keeping the environment appropriate to keep your mind in the right place, because if you have a ton of distractions, there's a lot of noise in the hospital, people are asking you a bunch of questions, it can be really hard to stay in the zone. So keep in mind your ambiance, the environment, keeping headphones in so that you can stay out of the noise and stay in your zone. The second tool that I want you guys to know about when it comes to keeping yourself comfortable and managing this labor pain is hydrotherapy. One of my favorite and go-to comfort measures in labor is hydrotherapy, aka water. Water is nature's epidural. So if you want to actually maintain comfort in labor and you feel like things are getting really intense, you're even thinking about an epidural at this point, go get in the water. That could be the shower, that could be the tub. And whether you're in the hospital or you're at home, you can do both of these things. having that water hit your belly or hit your back, and that pressure and the heat coming from that water has been a game changer for so many of my clients. And if you can utilize that, you can be in there as long as you want, but if you can utilize that, y'all, you will literally be so comfortable that you won't want to leave that shower. And you really don't have to. You can stay in there as long as you want. But hydrotherapy is absolutely the most crucial piece of labor when it comes to staying comfortable, if you can have that opportunity to utilize it. The third tip to managing labor pain and staying comfortable in labor is movement. Movement is a comfort measure, and I have a whole series on movement and station of your baby so that you know how to move properly, because that's also a key here. You do not want to move in ways that are not productive at the right time. But movement is a comfort measure, so avoid laying on the bed. Your contractions will feel much more intense when you're laying down, especially if you've been active throughout your pregnancy. And if you are trying to have a natural birth, movement is key to keeping your baby moving down the pelvis. So stay on top of your movement and help your partner prepare for this in pregnancy and coach you in labor. I have created and literally formed so many daddy doulas in my program that it has been so amazing to see how they've been able to coach their wives through labor, because they know what to do at the right time, because they know what they're looking for. So if you're interested in that and you want to make sure that you're prepared and your partner is prepared, check out all of my information on how I can support you and educate you and your partner throughout this pregnancy journey to make sure you both are prepared for labor. And the fourth tool I want to share with you is the TENS unit. The TENS unit is absolutely amazing. Using the gate control theory, and that helps block pain receptors from reaching your brain and allows feel-good receptors, aka endorphins, to be released so that you do not feel as much pain. I used the TENS unit in my second labor, and it was a game changer for me. You have a little button that you will use when you are having a contraction. You turn it on. There's little vibrations that go throughout your body. They do not hurt. And during the contraction, it releases all of the feel-good hormones for your body and allows you to kind of take the edge off of the contraction. And then when the contraction is over, you turn it off or you turn it down. And if you have not heard of the TENS unit, I highly, highly, highly suggest that you add it to your birth bag, because it will absolutely help you avoid getting an epidural or any other pain relief if you are starting to feel like you need some relief and all the other things that we've talked about so far are not working. I have an entire list of things that I encourage you to add to your birth bag to help you stay comfortable, pain management tools that you can utilize, that I've utilized for my clients, that I have in my own doula bag. But the TENS unit is absolutely one of the things at the top of my list that you should make sure that you utilize in labor. The only time you can't use it is in the water. So make sure that if you are using it and you decide to utilize the hydrotherapy again, you take it off and then you can put it back on when you get out of the shower or the tub. All right, y'all, that is it from me. I hope this was helpful. If you want more information or education or tools to actually give you these step-by-step on how to prepare for labor, how to prepare your mind, how to prepare your spirit, how to prepare your body, how to write a birth plan, how to make sure that your partner becomes daddy doula, check out my Work Your Birth program in the description below, and it will literally give you everything that you need, step by step, the questions to ask your provider, everything that you need to have a comfortable, beautiful, and empowering natural birth experience. And you can read about all the different testimonials and hear about the different birth stories of the families who have gone through this program and who have had these beautiful unmedicated births for the first time without anybody else in the room but the partner and mama. All right, y'all, that is it for me. I will see you on the next video.